Okay, hello all. We're gonna wait a couple minutes. Make sure we can get a few more people on. A lot of you guys are muted and your camera's off. We're filming this for our YouTube page, so unless you want to have your face on our YouTube channel, you guys can just keep your cameras off and muted. We'll wait a couple more minutes. If you have the time, the only thing we would preferably need for today would be a chair. And if you guys have a chair, great. If not, then you can go get one. I'd recommend it. We'll wait another minute for people to hop on.
That's cool. I have people on there.
Okay. Thanks, guys, for coming in. Thank you for taking your time. I'm Michael Van Portfleet. I'm a doctor of physical therapy with Mend Physical Therapy in Boulder, Colorado. Today, we're going to be talking about and going through different exercises for the knee and specifically knee pain. The exercises that we're going to do is going to be in a progressive manner, meaning that we're going to start pretty low and then progress up, but I will have a modification for each exercise. The parameters and the goals here are to just give you some tools and tricks to be doing strengthening on your own, especially in this time where gyms aren't open and it's hard to kind of have access to strengthening. We're going to give you a number of different resources here. Again, like I said, we're filming and we're recording on our YouTube page, so you can access our YouTube page after this, just to kind of go over these exercises again. We're going to start slow, build up. The parameters of today is, if you're having knee pain, we want to make sure that you're not aggravating yourself right now. So if you're to quantify your pain level, what we'd like to do is 0 is no pain, 10, you're going to the emergency room. We want to stay within like a 3 or 4 out of 10. If you exceed that, that's when we jump into an aggravating level of pain. That's not what we're looking for. A little bit of discomfort and pain is kind of good. We're stressing the tissue, and it's a good thing that builds resiliency of the tissue and allows there to be gains with that. So the 2 muscle groups we're going to work on today are primarily the quads and the glutes. The quads are the primary stabilizer of the knee, and then the glutes are the secondary stabilizer. So we're going to work on each of those muscle groups, kind of interchanging, doing supersets between each one of those. Each exercise is going to be performed for 30 seconds, and we're going to be going on both sides. So just to give you some expectation of what we're going to go with today. We're going to be around 30 minutes. So again, thank you so much for taking the time, and we're gonna get rolling here. All right, so first thing is we're gonna find a good space on the floor, lying on your back, starting with straight leg raises. Straight leg raises, you're squeezing that quad, almost trying to hyperextend that knee as you lift it up and then back down. We're going 30 seconds here. The key here is trying to keep that quad tight the entire time. We need to start waking up those muscles of the quad to help support the knee. Really focusing on extending that knee as much as you can. The back of the knee should hit the floor before the ankle does. And then we're going to switch over to the other side. The purpose of doing it on both sides here is to help re-educate the involved side. So say my right side is hurt, squeezing the left quad helps the brain remember that there's a quad here on the right side. It allows things to fire a little bit more on my involved hurt side. Really try to lock that knee out as much as you can. You should feel a nice contraction of that quad muscle as you keep that knee straight. Okay, now we're gonna roll on to our side. Now addressing the glutes. So legs straight, lifting that leg straight up. If you're by a wall, it is helpful to have that heel up against the wall and extend or lift that heel up, dragging against the wall. Now, instead of squeezing the quad, try to focus on squeezing the glute. You should feel those back muscles, the back pocket muscles burning with this. 30 seconds. Again, that glute is a secondary stabilizer of the knee. Really focusing on keeping that glute on will help support the knee if it's having pain. Just start feeling a little burn here. And we'll go to the other side. So these are just warm-ups. We're going to do 2 sets of warm-ups. And then we'll go on to our working sets, of which we'll do 3 sets each. And really trying to squeeze that muscle, lifting up, waking that glute, reminding the brain that there's a glute here to help support the knee. All right, great. And then we'll go back onto our back. One more set of the straight leg raises. If this is easy, you can make it more difficult by sitting up, just like that. If this is hard, I'd recommend just squeezing the quad. We call those quad sets. We'll go to the other side. Really engaging that quad as much as you can. The more we can get those muscles firing now, the better off they'll feel during the working sets. And we're on our side, back to our hip, squeezing the glute. You can see that I'm kind of internally rotating my leg where my toe is down. If you can do that, makes it a little bit more difficult. If this is hard, then going just to a clamshell. Okay, and then we'll go the other side. Two more. 1, 2. Nice. Good. So we got those muscles now woken up. Your brain is more oriented to knowing what these muscles are supposed to do to help support the knee. Next, we're going to go to our working set. So the first exercise is using your chair. It's a simple sit to stand. Tapping your hips down on the chair. Now, if this is painful or too difficult, sitting all the way down. And coming up, you can help with your hands as well. If it's too easy, take a half step out, full squats. Two more. Then right into a wall sit. Wall sit, really focusing on squeezing the quads in this position. Ultimately, you'd like for there to be a 90-degree angle at your hip and a 90-degree angle at your knee. If it's too easy, sink down lower. If it's too difficult, you can make it more of a shallow squat. Holding. Try to squeeze those quads. Again, this is another recruitment exercise, really trying to focus on squeezing those muscles here to help support it. And then we're going to go right back to the sit to stands. With this, you can allow those knees to go over the toes. I think it's a myth to not allow those knees to go over the toes. Appropriate squat mechanics require your knees to go over the toes. But make sure your knees are tracking over, if you can look down, your third toe. And then back to the wall sit. So when I say knee tracking over the third toe, not in like this, not out like that. The middle of the kneecap should be going right over the third toe. And hold. Should be feeling a nice little burn in these muscles here. Again, there might be a little discomfort in the knee. That's okay. If it exceeds that 3 or 4 out of 10, that's when you come out of it, make it a little easier, or take a little break. And we'll do one more set. Sit to stands. Nice, slow, controlled pace. Letting those knees track over the toes. And then the wall set, 30 seconds. Try to breathe through it. You'll feel a little burn. That's a good thing. Those muscles are waking up to help support the knee. Okay. 5, 4, 3, 2, 1. Nice job. Nice job. Okay, next we're going to go to our next superset. The first exercise is a bridge. So on your back, heels digging into the ground. You can even lift your toes up, hands at your side. All you're doing here is lifting up, squeezing those glutes. Keeping those glutes tight, we're holding for 30 seconds. If this is easy, consider doing a dynamic movement. Just hips up and down. If this is hard, you're starting to feel this in your low back, what I would recommend, dropping your hips down, tucking them, tucking the hips to take some pressure off the low back. And holding. Really trying to, again, get that brain aware that these muscles are here to help support your hips and knees. And then we're going to flip over into a plank. Now the key here is, this is not a standard plank. You're really focusing on the quads, squeezing those quads, driving those knees straight and holding. If you do that, you'll really find that there's a nice little quad burn. And again, same thing here. If this is difficult, come on to your knees. This is easy. Go on to one leg. Or holding. Really focus on driving those knees as straight as you can. And we'll switch back into the bridge. Up, squeeze and hold. Drive those heels into the ground. That helps recruit these muscles here. Keep holding, keep squeezing. Back to the plank. Hold. Good job, guys. Keep going. You notice that your heart rate might be going up. There could be increased respiratory rate. That's a good thing. Your heart's working to help bring some nutrition and healing back into that knee. And again, back to the bridge. Up, squeeze. Good, very good. Keep those knees apart. Don't let them cave in. Don't let them go out. Your hips, your knees, and your feet should be in alignment. Squeeze, squeeze for 5, 4, 3, 2, 1. Nice job. Okay, next we're going right back into it. So you're going to stagger your stance a good distance here. 75% of your weight should be on the front leg. We're going to hinge over that front leg and come down into a little mini lunge. Again, most of your weight's on that front leg. Letting that knee come forward. The knee can come forward over the toe. That's not a bad thing. If this is too hard, just try to hold it, or maybe a more shallow lunge. If it's too easy, go deeper. If you have something to hold on to, if you're having a hard time balancing, try to grab onto something. It's not a balance exercise, it's a strength exercise. I'm going to switch. Keeping that knee over that third toe, trying to maintain good mechanics of how that knee should bend. Not going in, not going out. Okay. Now from here, we're about 3 feet away from your chair. Standing on one leg, kicking the opposite leg back, reaching forward and touching the chair in the back. The forward reach, or like a single leg deadlift. Again, if this is too difficult, kickstand, put that foot down, that back foot down. The same thing. Or if this is too easy, go all the way down to the floor. Again, same story here. Try to stay within that 3 or 4 out of 10 pain. This may be reproducing your symptoms. That's not a bad thing. But we don't want to make it aggravated. We don't get into the aggravation state. We want to stay within a therapeutic state. And switch. Now this one is a little bit more balance challenging. If you feel like you're just having a hard time with it, just keep that back foot down. Okay. Now back to the lunges. Most of your weight on that front leg. Should really feel that quad working to help control that knee as it goes forward. These muscles should be working pretty hard. You should feel a nice little burn with it. Switch. And there's this thing in the brain, it's called the corpus callosum. And it is kind of like your bypass from one hemisphere to the other in your brain. So if your right knee hurts, working that left knee will help the brain remember how to do it on the right knee. Okay, forward reach. You should feel a lot of this in your hamstring and glute. Just like any other exercise that we do, we'll switch. Just like any other exercise that we do, really focus on engaging the muscle while you're using it. So the quad specific exercises, focus on engaging the quad. On the glute specific exercises, be intentional. about squeezing, using that glute. If you got to be back there to kind of wake it up a little bit while you do it, that's totally fine. Okay, last set. Squeeze that quad on the way down and back up. Way down and back up. You got one more. Good. Switch. Most of your weight on that front leg. Hinging over that front leg as you do it. Again, allowing that knee to go over the toe. Totally fine. Squeeze that quad as you do this. Make it intentional. Make these exercises intentional for building the appropriate muscles to help support the knee. Okay, forward reach. If you feel like you're getting used to this, again, challenge yourself. Go a little bit further down if you can. Okay, and we'll switch. Good, keep going. 3 more. Okay, last one. All right, the last superset here. Again, this is, we're progressing. We're making things a little bit more difficult. Bulgarian split squat. So again, if you have a chair, you want the back leg on the chair. If you don't have a chair, you can just do it up on a wall. That back leg's on a wall. See, back leg's on a chair, coming down, back up. Again, now if this is easy, if you have a weight with you, you can load it with a weight. You can go further down and hold, and then come back up. If this is difficult, bring that foot down, and we'll just go back to a lunge, standard lunge. Okay, and we'll switch to the side. Again, so if your challenge is for balance, you can hold on. Nice, nice work. And then next, into a modified side plank. On our side, lifting your hip, you're holding. So you're on the bottom side, you're on the right knee. The knee's bent at 90 degrees, left leg is up. You're holding here. This is a glute specific exercise, so squeeze that glute. If this is easy, you can drop that hip up and down, or you could do a little hip abduction here. This is tough, just bend the other knee. Stack it on top of the right one. Isometric, holding, squeezing that glute as much as you possibly can. Good, keep holding. Okay, we'll go to the other side. Hold. Whatever you want to do with this top hand, you can bring it down for extra support. Put on your hip, you can raise it up. Really try to hold. This one's a burner. All right, back to the Bulgarian split squats. Rear foot elevated, coming down. Again, as we increase the difficulty and intensity of these exercises, be cognizant of where your level of symptoms are at. If they're itching above that 3 or 4 out of 10, maybe decrease or modify. Okay, and we'll go to the other side. These type of exercises, these single leg exercises are great for runners, for weightlifters, for jumpers, especially these dynamic stability, the ones that challenge your balance as well. These are great to help bring some muscle awareness, wake up those muscles to help support the knee while you're running. Okay, side plank. Keep holding. All right, I'll switch. After this, we got one more set, and that's it. Then we're done. Keep holding. Really try to squeeze those glutes. The stronger those glutes are, the better position those knees will be, especially when your feet are on the ground. Keeping those glutes on will help. Okay, last set. Last set. Coming down, perfect. Squeeze those quads, squeeze those glutes in this one too. This one's a little combination of a quad and glute exercise, where the modified side plank is just exclusively glute. Okay, we'll switch.